Hello, Mr. Watson. Thanks a lot for joining us today for the Careers Week interview. Would you mind introducing us for a bit, just briefly?
I'm Graham Watson. I'm a consultant urologist in this hospital, and here to tell you why doing urology is not a bad decision at all. So first of all, what's in urology? It's now broken down into subspecialities. So if you pan over to the board there, you'll see that there are reconstruction urologists who do this wonderful operation, urethroplasty, urinary diversion, or making neobladders, deal with incontinence. Then there are the andrologists who deal with impotence and infertility. And how wonderful to assist a childless couple with getting their baby. And I've had great pleasure from any infertility work I've had which has been successful. Oncological surgery, cystectomy, removal of the bladder, nephrectomy, nephroureterectomy, orchidectomy, removal of the testicle. Stones, which is my particular area of interest, stones in the urinary tract. General urology, which is the TURP, the TUR of the bladder tumours, the scrotal surgery. And paediatric urology, which is really doing everything but only in children. And you would be a reconstruction urologist, you'd be an oncological surgeon, and have to be all of those things for children.
Right. Yeah, that's a really brief introduction as to what's urology about, Mr. Watson. But can you tell us why specifically urology? What sparked the interest in the beginning of your foundation years, maybe, or med school even? So, do you mind shedding some light on that?
My decision to do surgery first was because I really liked to intervene and make a difference, and the margins have got blurred now with interventional gastroenterology, cardiology. Everybody's intervening, but the ability to tweak the system and make an enormous change. And in urology, we can have somebody going around with a catheter. We can transform their lives by getting them to pee again, by doing their TURP. We can save their lives by removing some horrible cancer. Stones, which is my particular interest, the pain from stones can be extreme. People will say that it's more painful to have ureteric colic than to go through childbirth, and that it's the worst pain they've had in their lives. We can do this minimal intervention and transform them and get rid of the pain. So the ability to really help patients is one of the real joys in whatever you plan to do.
Sure. I absolutely agree to that, Mr. Watson. Keeping in mind our young foundation doctors and who the Careers Week more or less is directed towards, can you tell me what exactly in terms of mindset or portfolio-wise or preparation does it require to get into urology?
In order to get accepted into a urological training scheme, you first of all have to do your basic surgical year. And as much as possible, you want your CV to reflect that interest in urology. So if you have not done a period of time doing a urology job as your foundation year, that you would go and take a week of special interest in it, that you would show some interest in urology, tweak your audit in some way so that it looks urological. And in your basic surgical years, to try to cover urology if at all possible. This will all help.
Right. That's quite brief in terms of what is required. The other question is, you've decided to do urology. You've been doing it for quite some time now. What do you love about it the most? It's something that really excites me to ask, especially surgeons who have done quite extensive work. What is that one thing that keeps you going? Why are you so motivated, despite having to do this day in, day out? What keeps you going?
I qualified in 1976, and that's a lifetime ago, isn't it? And I've maintained my interest. Now, what fired it up initially was research. And I was told to go and find a way of breaking stones with lasers. I did. I had to go to America to do some of that basic research, and that got me on the international professor line. I was going around the world as a junior registrar, being the visiting professor, turning up in China, Taiwan, Thailand, India. And then I'd come back to clerk in the patients and get told off by the anaesthetist. But it was that huge kick to my career, working out, which opened up so many doors, and amazingly, the research has ended up with just about every centre in the country, in the world, having a laser to break up stones. Teaching has kept me interested, but I would say that one of the great interests is treating patients and having them say, "Oh yes, Mr. Watson, you did my stone in 2010. Please, nice to meet you." And that's so gratifying. The final thing that's really got me going has been global surgery and training urology worldwide, and this is what's keeping me going past my sell-by date, because I have found that by going and training in a country, that it has really enhanced my skills. I've helped them. I've got, for example, Sri Lanka from going from doing no endoscopic surgery at all to being 100% endoscopic stone surgery. But in the process of teaching them, my skills got a real boost, and I have evolved and adapted even in my later years. So everything keeps evolving, and I would say to you, keep evolving all the time, keep accruing those skills.
Exactly, Mr. Watson. You mentioned about keeping evolving and how to keep up with your skills. How do you come across facing challenges as a urologist, whether it would be the first time you had an operation, doing it yourself, or something even now after having such an extensive career? What are the challenges that you face as a urologist day in and day out, or even one-off as well?
Well, let me go back in my training and tell you some things which went really bad. My first cholecystectomy as a trainee general surgeon, the patient developed gas gangrene of his abdominal wall and was found to have Clostridium growing in his bowel. Not my fault, but I felt terrible about it. I thought this was going to be the death knell to my career. It's not, and it's right that you should feel terrible pain about anything that goes wrong, but you live on, you learn, and as you accrue more skills, these things come less often. So you avoid complications more as you get more senior, and you, I'm afraid, will hit them a lot as a junior surgeon. Just remember that. Remember those lessons to the very depth of your soul, and make sure that you keep as far away from those errors that you can. Some things are inescapable, though.
Was it something related to the mindset, or the sort of trainers you had, or your supervisor was really good or really helpful? How do you try to motivate yourself? How do you come back from having the incident which you had in your initial stage of your surgical career? How do you bounce back from that, basically?
My message really is, you think it's the end of your career, it's not, and that you will be forgiven as long as everybody knows you've learnt the lesson, and everybody should feel traumatized by such an event, but you move on, and that makes you the stronger for it, but not so strong that you ever become impervious.
Right, so it's all about maintaining a balance between knowing what needs to be done and at the same time accepting criticism and having a good balance in terms of going forward in your surgical career.
So what I think a trainee should try to convey to the trainer is, number one, complete honesty. Number two, taking sufficient thought before undertaking any procedure, learning from every mistake, showing keenness, going the extra mile to get any extra experience that you can, and always being eager to learn and eager to gain your skills.
After listening to all of this, I dare ask you, what if no urology? What Mr. Watson would have been if not urology? If there's any other subject that you were keen or interested in, or must have sort of had a sort of dwindle or thought about, probably, if not urology, maybe I might end up doing this. Have you ever thought about it? Or?
I just happened by chance to get into urology, and what was wonderful about it at the time was that it was going through such changes and evolving at such a speed, and that was the most attractive thing about it, that you could get onto that bandwagon and contribute to the development. But I honestly believe that I could be happy in any branch of medicine or surgery. I would particularly like it to be something where I can intervene and make a big difference. Perhaps I can just say, what are the negatives that we've got to overcome? And those negatives include medico-legal aspects. So if the lawyers get interested in you, there will be complaints, there will be things that go wrong. And what I would say is, don't practice defensive medicine, practice good medicine, because that's the only defense. Think very carefully about everything that you do and the possible outcomes, but and think your strategy out very carefully in advance. And also know your patients, and because that's where the great joy comes from it. And the final lifestyle is keep healthy, keep fit, and don't think that don't forget about things like exercise, because it's the greatest stress buster going. That you go for a run, you play a game of squash, whatever you want to do, but you have something very healthy as your anti-stress.
Thanks a lot, Mr. Watson, for all the insights and in-depths into urology and also life lessons as well, and hopefully we'll learn a lot from this. It's a pleasure talking to you.
Simon, just before we switch off, can I just say a little bit about global surgery?
Sure.
Because global surgery, there are 30 million people on the planet at any one time facing death or catastrophic loss of their income and their family's income. And it is such an uneven playing field that we live in this world, and it's global surgery which has made me keep working, even though I'm in my very late 60s at the moment. And it's teaching and training and helping out, which are just the biggest boost to whatever you do. So you can turn up at a meeting and you have people who you've helped and they come greet you. It is so heartwarming. But in terms of skills, it's enhanced my skills enormously.
Thanks again, Mr. Watson, for all the insights into urology, and it was a pleasure chatting to you. Thank you so much.